Before we get to remedies, let's quickly get on the same page about what we're even talking about, because chest infection gets used pretty loosely. A chest infection is an infection of your lower respiratory tract, your airways and lungs, as opposed to your nose and throat. According to the NHS, the two main types are bronchitis and pneumonia. Bronchitis is inflammation of the main airways, usually caused by a virus. Pneumonia reaches further down into the lung tissue itself and is more often bacterial. That distinction matters a lot here. If your chest infection is viral, which per NHS guidance most bronchitis cases are, antibiotics won't do anything. Your body has to clear the virus itself, and what you're really managing is symptoms and comfort while that happens. If it's a bacterial infection like many cases of pneumonia, that's a see a doctor situation, not a try this tea situation. So most of what we're talking about today, honey, steam, hydration, rest, these are things that can make a viral chest infection more bearable and possibly shorten some symptoms a little. They are not antibiotics. They are not going to fight off bacteria. I want to be upfront about that distinction right from the start because a lot of content online blurs it completely. Typical symptoms, according to health sources including the NHS and Cleveland Clinic, include a chesty cough that may bring up yellow or green mucus, wheezing, feeling short of breath, chest discomfort, fever, headache, and general fatigue. And according to the NHS, for most people, these symptoms get better on their own within about 7 to 10 days, though the cough itself can hang around for up to 3 weeks. That lingering cough after everything else clears up is really common. It's your airways healing, not necessarily a sign you're still fighting an active infection. Okay, foundation laid. Let's talk about what might actually help. I'm going to start with the least exciting, most repeated advice out there. Drink fluids and rest. I know. Groundbreaking content. Stay with me though, because this is genuinely backed by basically every credible medical source I looked at, and the mechanism makes sense. When you're dehydrated, mucus in your airways gets thicker and stickier, harder to cough up and clear. Staying well hydrated, water, herbal teas, broths, helps keep mucus thinner, so your body's natural clearing mechanism, coughing, works more efficiently. The NHS specifically recommends drinking plenty of fluids as part of managing a chest infection at home, and multiple hospital and health system sources echo the same thing. Fluids help thin mucus in the chest, making it easier to cough up and clear the infection. Rest is similarly unglamorous but important. Your immune system uses a substantial amount of energy fighting an infection, and pushing through a full workday, workouts, or a jam-packed schedule diverts resources away from that process and can prolong how long you feel unwell. This isn't some deep scientific mystery. It's just that your body does better at healing when you're not also asking it to do everything else at full capacity. So yes, I know drink water and rest isn't a satisfying answer for a video with best remedies in the title. But if you take away nothing else from the flashier sections coming up, take away this. Hydration and rest are the actual foundation. Everything else is, at best, adding a bit on top of that. All right, now let's get into the ones people actually ask about, starting with honey, because out of everything I researched for this video, honey has genuinely the best evidence behind it of any natural remedy for cough symptoms. Cochrane, which is about as gold standard as evidence reviews get in medicine, has published and updated a systematic review specifically on honey for acute cough in children multiple times, most recently incorporating 6 randomized controlled trials involving several hundred children. And according to a Mayo Clinic summary of this research, honey appeared to lessen coughing and help people sleep better in people with upper respiratory tract infections, and these studies included children. Now, I want to be careful not to oversell this, because Cochrane's actual language is more measured than a lot of honey hype articles out there. The review found honey probably reduces cough frequency better than no treatment or placebo, with moderate certainty evidence. But when compared against dextromethorphan, the ingredient in a lot of standard over-the-counter cough medicine, there wasn't a meaningful difference between the two. So honey seems to outperform doing nothing and seems roughly comparable to standard OTC cough suppressants. Mayo Clinic also notes that in these studies, honey appeared to work about as well as diphenhydramine, an antihistamine sometimes used for cough, though they add that higher quality studies are still needed to really confirm that. I do want to flag one real limitation here because it's important for interpreting the evidence honestly. Most of the children in these trials only received honey for a single night before researchers measured the effect. So we have decent evidence that honey can help with a cough on a given night, but less evidence about what happens if you use it consistently over a week or two of a chest infection. It's a real gap in the research, not just a technicality. Practically, how you'd use it. Mayo Clinic's guidance is that people over the age of 1 can have about half a teaspoon to a teaspoon of honey, either on its own or stirred into a warm drink like tea. And this can be repeated as needed for cough relief. And this next part is not optional information. This is a genuine safety issue, not a some people worry about this caveat. Never give honey to a child under 12 months old. Because of the risk of infant botulism, a rare but serious form of food poisoning, honey is specifically unsafe for infants, and every credible source on this issue, Mayo Clinic, the NHS, pediatric guidance broadly, is unanimous and firm about that age cutoff. So, bottom line on honey, reasonably good evidence, genuinely one of the better supported options in this whole list, safe for most people over 1 year old, easy to access. If you only take one thing from this video and try it tonight, honey and warm tea is probably it. Okay, now for the one I actually went in expecting to be a slam dunk and came out much more skeptical of: steam inhalation. You've probably seen it, leaning over a bowl of hot water with a towel over your head, or just sitting in a steamy bathroom. It's one of the most commonly recommended home remedies in the entire natural cold and chest infection genre, and the NHS itself even mentions using an air humidifier or inhaling steam as something that can ease symptoms. But here's the thing. When I actually dug into the Cochrane review specifically on this, heated, humidified air for the common cold, the picture is genuinely mixed, not a clear yes. Cochrane's own summary states it plainly. This review found that in some studies, inhaling steam helped symptoms. In others, it did not. The conclusion is that there is not enough evidence to support steam inhalation for the common cold. In the most recent version of that review, researchers found no meaningful effect of steam treatment on rhinovirus shedding, meaning it didn't seem to actually affect the virus itself, and results on symptom relief were what researchers called equivocal. Some studies leaned positive, others found nothing, and the overall evidence quality was assessed as low. I want to be clear, this is genuinely mixed evidence, not cherry-picked negativity. There's an older, smaller trial, a 1987 study published in the American Journal of Otolaryngology, that did find steam inhalation reduced cold symptoms and improved nasal airflow more than placebo. So it's not that every study says it does nothing. It's that when researchers pooled the whole body of evidence, results didn't consistently point the same direction, and Cochrane explicitly says there isn't enough evidence to make a confident recommendation. Now here's the part that actually surprised me the most, and I think it's important enough that I want to spend real time on it rather than rushing past. Steam inhalation, done the traditional bowl of hot water and a towel way, has a real and documented injury risk. A study published in the British Journal of General Practice looked at burn injuries specifically caused by steam inhalation therapy and found this practice, despite having no proven clinical benefit, was linked to real scald injuries, particularly in children, from the classic scenario of a bowl of boiling water being knocked over. Researchers in the Netherlands, in a separate study published in that same journal, quantified this too, tracking burn center admissions specifically caused by steam inhalation and putting real annual costs on it in terms of medical treatment. During the early COVID-19 pandemic, one burns unit in Birmingham reported a genuinely dramatic spike, a 30-fold increase, in child scald injuries specifically tied to steam inhalation attempts at home, as families leaned on the remedy more heavily. So here's my honest read on this, and it's more nuanced than either steam works great or never do it. If you enjoy sitting in a warm, steamy bathroom or using a humidifier in your room, that's very likely safe and might offer some subjective comfort. There's really no meaningful harm in a hot shower with the door closed. But the classic bowl of boiling water with a towel over your head method carries a real documented burn risk, especially around children, for a benefit that the best available evidence says is inconsistent at best. The NHS itself, interestingly, in some of its own patient guidance, specifically warns not to let children breathe in steam from a bowl of hot water because of the scalding risk. So my honest take, a warm shower, a humidifier, or generally staying in humid air is a low-risk, possibly mildly helpful thing to try. The traditional bowl method is one I'd personally skip or at minimum handle with real caution. No children unsupervised, ever. And honestly, even then I'd lean toward alternatives. Real quick, before we move on, I want to know something from you. In the comments, tell me, which of these remedies did you grow up believing was basically medical fact? For me, it was steam inhalation, 100%. I was today years old when I found out the evidence was this shaky. Drop yours below. I'm curious how universal some of these home remedy beliefs actually are across different households and cultures. Okay, back to it. Vitamin C might be the most iconic fight-off-a-cold supplement there is. So let's actually look at what the evidence says, because I think most people's mental model of vitamin C is more optimistic than the data supports. The main body of evidence here comes from Cochrane reviews led by researcher Harry Hemela, which have been updated multiple times. And the top-line finding is honestly a bit deflating if you were hoping vitamin C prevents you from getting sick in the first place. Regular vitamin C supplementation did not reduce the incidence of colds in the general population. Taking it every day, long-term, doesn't seem to stop you from catching a cold or chest infection in the first place. Where it gets more interesting is duration. The Cochrane review found that regular vitamin C supplementation was associated with a modest reduction in how long cold symptoms lasted, around an 8% reduction in duration for adults, and a larger reduction, around 14 to 18%, for children, though I'd flag that the child-specific numbers come from fewer trials and should be read with a bit more caution. To translate that into something practical, an 8% reduction on, say, a 7-day cold works out to roughly half a day shorter. It's a real, statistically consistent finding across many trials, but it's a small effect in absolute terms, not a dramatic one. There's one group where the evidence is notably stronger: people under brief periods of intense physical stress. The Cochrane review mentions marathon runners, skiers, and soldiers in subarctic conditions saw their risk of catching a cold roughly cut in half with vitamin C. That's a meaningfully bigger effect, but it's specific to extreme physical exertion, not something that necessarily generalizes to everyday chest infections. And importantly, when it comes to taking vitamin C after you're already sick, which is really the scenario most people watching this video are actually in, the evidence is much weaker. The Cochrane review found that trials of vitamin C started after symptoms had already begun showed no consistent effect on how long the illness lasted or how bad it felt. So if you're already coughing right now and you start popping vitamin C, the evidence doesn't strongly support that changing your course. There's also a more recent meta-analysis by the same lead researcher, Hemula, along with Elizabeth Chalker, published in BMC Public Health, which looked specifically at whether vitamin C had a bigger effect on more severe cold symptoms compared to milder ones, and did find some signal that the benefit might be somewhat larger for more severe symptoms. But again, this is a secondary analysis building on the same underlying relatively modest effect sizes. So, honestly, vitamin C is safe, it's cheap, and there's a real, if modest, research basis for a small reduction in cold duration with regular use. But it is not a chest infection cure. It doesn't reliably stop you from getting sick, and the evidence for taking it after symptoms start is genuinely weak. I'd file this one under reasonable to include as part of a generally healthy diet, not essential remedy you need to stock up on. Related to vitamin C, but a separate nutrient with separate research, zinc. A systematic review published in the American Journal of Tropical Medicine and Hygiene looked specifically at micronutrient supplementation, zinc, vitamin D, vitamins A and E, and cold outcomes in healthy adults. It found that, unlike most other micronutrients studied, zinc supplementation was associated with a reduction in cold duration, on the order of a little over 2 days shorter, when given on its own. That's a more meaningful effect size than what we saw with vitamin C, and it lines up with another source I found, a review of complementary and alternative medicine evidence for the common cold noted zinc lozenges were effective in about 5 out of 9 trials, with researchers suggesting mixed results likely came down to differences in dose and formulation, rather than zinc simply not working. I want to flag a genuine limitation here too, in the spirit of not overselling anything. This research is largely about the common cold specifically, not chest infections or bronchitis as a distinct category, and cold symptoms and lower chest infection symptoms aren't identical, even though there's real overlap and colds can progress into chest infections. So take the zinc findings as reasonably solid for upper respiratory symptoms, with less direct evidence for how it performs against an infection that's already settled into your chest specifically. Practically, if you're going to try zinc and you're on any other medications, this is genuinely one where I'd say talk to a doctor or pharmacist first, because zinc can interact with certain antibiotics and other drugs, and taking too much zinc over time can actually cause its own problems, including affecting your copper levels. This isn't a just to be safe throwaway disclaimer. Zinc has real drug interactions worth checking on if you're managing any chronic condition. Ginger is everywhere in home remedy content for coughs and chest congestion, so let's look at what's actually behind that reputation, because this is a case where I think the marketing has run pretty far ahead of the human evidence. There's real published laboratory research suggesting ginger compounds have antiviral, anti-inflammatory, and antimicrobial properties. For example, one study published in the peer-reviewed journal Antiviral Research found that fresh ginger extract showed antiviral activity against human respiratory syncytial virus in human respiratory tract cell lines, meaning it worked in a lab setting on cells in a dish, not in an actual sick person. That's an important distinction I want to be really clear about. Laboratory and cell-based evidence is a meaningfully different and much earlier category of evidence than a clinical trial in actual humans with actual infections. When I looked for direct human clinical trials on ginger, specifically for chest infections or bronchitis, the picture gets much thinner. There is a randomized controlled trial that tested ginger in outpatients with COVID-19 specifically, and it found ginger had no significant impact on most clinical outcomes measured, including viral clearance rates, oxygen saturation, and body temperature, when compared to placebo, though it did note a reduction in a specific imaging finding, pulmonary infiltrate, on a follow-up scan, and confirmed ginger appeared safe with no notable increase in adverse events. So in the one clinical trial I found looking at a real respiratory infection specifically, results were largely null on the primary outcomes, with one more preliminary positive finding. So my honest assessment, ginger has a genuinely interesting research profile at the laboratory and mechanism level, and it's very likely safe for most people in normal culinary or tea amounts. But if someone tells you ginger tea will meaningfully fight off your chest infection, that claim is running well ahead of what human clinical trials have actually shown so far. I'd put this in the pleasant, probably harmless comfort measure category rather than evidence-backed treatment. If you enjoy ginger tea, there's no real reason not to have it. Just don't expect it to be doing heavy lifting against the infection itself. Garlic gets recommended constantly for immune support and fighting off colds, so I want to be straightforward here. The clinical evidence is thin. Cochrane has reviewed this specifically in a review titled Garlic for the Common Cold, and their own summary is refreshingly blunt. There is no conclusive evidence to recommend garlic supplements as a preventative or treatment option for the common cold. The reviewers were only able to find a single randomized controlled trial that actually met their quality criteria for inclusion. Everything else that existed on the topic wasn't rigorous enough to count. That one trial did find something interesting. Participants who took a daily garlic supplement over 12 weeks had fewer cold occurrences than the placebo group. But Cochrane's own consumer summary of this finding describes the certainty as very low, essentially saying we're genuinely uncertain whether this result would hold up, and the same trial found no meaningful difference in how long a cold lasted once someone actually caught one, comparing garlic to placebo. So to summarize accurately, one moderate quality at best trial hints garlic taken daily over months might reduce how often you catch a cold. There's essentially no evidence garlic helps once you're already sick. And Cochrane's own conclusion is that current evidence is insufficient to make a real recommendation either way. Garlic is a normal food with a long history of safe use in cooking, so there's no real harm in including it in your meals while you're sick, the same way you might have soup with garlic in it because it's comforting and you like the taste. Just don't count on it as a real treatment for an active chest infection. The actual clinical evidence doesn't support that expectation right now, whatever the popular reputation might suggest. I want to include this section because I think it's just as important as the what might help list, and it gets skipped a lot in this kind of content. Steam inhalation's burn risk, which we covered, that's a real, documented harm, not a hypothetical. Cough medicines for young children are worth flagging too, even though it's slightly outside natural remedies. Multiple sources reference that health authorities, including historically the American Academy of Pediatrics, have recommended against giving OTC cough and cold medications to children younger than 4, due to a lack of demonstrated benefit and real potential for harm. This is actually part of why honey has been studied so much in children. It's being looked at as a genuinely safer alternative for that age group. And then there's the honey in infants issue we already covered, which bears repeating because it's genuinely serious. Never under 12 months old because of infant botulism risk. More broadly, something I noticed across pretty much every credible medical source I read while researching this. None of them frame any home remedy as a replacement for medical care when it's actually needed. They're consistently framed as symptom support alongside appropriate care, never as a substitute for it. I think that's a genuinely important pattern, and it's the same message I want to leave you with. Okay, this is genuinely the most important section of this entire video, more important than any remedy we've talked about, so please don't skip it, even if you've heard some version of this before. According to the NHS, most chest infections get better on their own within about 7 to 10 days, with the cough itself potentially lingering up to 3 weeks as your airways heal. That's normal and doesn't necessarily mean anything is wrong. But there's a specific list of warning signs where multiple health sources, the NHS, and various hospital systems I reviewed, consistently agree you should see a doctor and in some cases seek urgent care. I'll list these clearly because this is the highest value information in this whole video. Severe difficulty breathing, meaning you're struggling to speak in full sentences without pausing, gasping, or feeling like you're choking for air. Severe chest pain in the middle of your chest that doesn't go away, especially if it feels like pressure, tightness, or squeezing, or if that pain spreads to your arms, back, neck, or jaw. That combination in particular is something you treat as a potential emergency, not a wait-and-see situation. Feeling unusually drowsy, or finding it hard to wake up or stay alert. Your lips or skin turning pale blue or gray on brown or black skin. The NHS specifically notes this can be easier to spot on the palms of your hands. A high fever that's persistent, particularly one that comes back after seeming to go away, or lasts more than a few days. A cough that lasts longer than 3 to 4 weeks without improving. Coughing up blood. And confusion, especially in older adults. Several sources specifically flagged this as a red flag symptom that's sometimes overlooked, because in older patients, confusion can actually be one of the more prominent signs that an infection like pneumonia has become serious, sometimes even more prominent than a high fever. Beyond the specific symptoms, there are also groups of people who should have a lower threshold for seeing a doctor in general, rather than trying home care first. This comes up consistently across NHS and hospital guidance. That includes anyone over 65, young children, pregnant people, anyone with a weakened immune system, and anyone with an existing long-term health condition like asthma, heart disease, diabetes, kidney disease, or COPD. If that's you and you're dealing with chest infection symptoms, checking in with a doctor sooner rather than later, even for what feels like a moderate infection, is the genuinely appropriate move, not an overreaction. And I want to specifically call out one thing that matters a lot for this video's topic. If you are on medication for blood pressure, heart conditions, or really any chronic condition, please talk to your doctor or pharmacist before adding in supplements like zinc or high-dose vitamin C, or making major changes to your routine while sick. Some of these can interact with medications in ways that genuinely matter, and it's natural doesn't mean it can't interact with what you're already taking. A quick conversation with a pharmacist, which is usually free and doesn't require an appointment, can clear this up fast. So to bring this together, hydration and rest sit at the foundation, doing the most unglamorous but genuinely necessary work. Honey has the strongest research behind it as an add-on for cough relief. Zinc has a reasonably solid case for shortening cold duration. Vitamin C has real but modest evidence, mostly for prevention during physical stress rather than treatment after you're already sick. Steam inhalation, ginger, and garlic range from mixed evidence to promising but early, with steam inhalation carrying a real safety consideration, especially around kids. None of these, not one of them, replaces medical care when your symptoms are telling you something more serious is going on. That's not me being overly cautious for the sake of it. That's just an honest reflection of what the research and every credible medical source I found actually supports. If this deep dive, check the source's approach to health content is useful to you, let me know in the comments, and subscribe if you want more. I've got a growing list of other natural remedy claims to run through this same process. Take care of yourself, drink your water, and if that cough is telling you something's wrong beyond a normal chest infection, please actually go get it checked out. I'll see you in the next one.